Ramaswamy Govindan, Professor of Medicine, Washington University School of Medicine in St. Louis. Cancer is a disease where the cells keep growing without any restraint. And not only that, they break into tissues, go to different parts of the body, and that's what cancer is all about. And how does this happen? This happens because the intrinsic processes within the cells are messed up, or the basic mechanisms that control the organized process of cell growth is completely broken. And this happens because the genes inside the cells get messed up. And each and every cell in our body has about 20,000 genes. And these genes govern the normal processes of cell growth, division, control, how long they live, etc. So what happens in cancer is that these genes get altered or mutated. Mutation means change or alteration. And these genes, when they get altered, give the cells the power, or the cells lose their abilities to control or govern themselves in an orderly way. And so these mutations, they accumulate over time and they lead to cancer. And until about 10, 15 years ago, we did not have the tools or the technologies to map out these genes in their entirety. We were able to do, even then, 15, 20 years ago, we could take a piece of a gene or a segment of a gene and then see how it was messed up. But today we can look at all the 20,000 genes in one go and compare it with the patient's normal tissue, for example, blood or skin tissue or normal non-cancerous tissue, and compare how is that altered, how is the cancer genes are altered, or genes in the cancer cells are altered compared to the normal tissue. So this ability to look at the entire, suite of several genes, in some instances a few hundred genes, in some instances all 20,000 genes, is the genomic characterization, is what is called the genomic characterization. In the true sense of the word, when you talk about genome, you're looking at all the 20,000 genes and how they really help organize the whole processes. But for cancer gene testing, and for the ease and convenience, we look at often a few hundred genes that are altered in the cancer cells. This is what we call panel testing. And even though there are 20,000 genes in each and every cell, not all these genes, when they get altered, give rise to cancer or play a part in the cancer process. Only about 300 genes or so, 300 to 400 genes or so play a role in the cancer initiation progression. So for practical purposes, what we do is we send a piece of the tumor tissue for this characterization of about anywhere from 300 to 400 to 500 genes, depending on different labs. And that gives us a good idea of what genes are altered in these tumor cells. And it so happens that out of those 300 to 400 genes that can cause cancer, a handful of them are now amenable for therapy or targets for therapy. And in lung cancer, for example, the most common gene that is altered that we go after with the conventionally available therapies today is the EGFR gene mutation. And increasingly that the options for patients for targeted therapy, they are increasing. Now we have additional other alterations, including ALK, ROS, RET, MET, and now we are testing KRAS mutations as well for targeted therapies. So the idea of looking at this panel of several hundred genes in one go is called genomic characterization. The panel are called panel testing or molecular biopsies. And we now do this not only in the tumor tissues, but also we can do this in the blood sample we call the liquid biopsy. And the blood sample, of course, is based on the idea that the cancer cells put out these genes or the cancer DNA, cancer gene mutations are present in the bloodstream because the cancer cells shed the DNA in the bloodstream, and we can pick that up with modern technology. Of course, the idea is it is very convenient. You don't have to stick a needle in the tumor, less invasive. All you need is to get a tube of blood. The downside is sometimes we don't pick up these gene mutations that are present in the tumor cells because the tumor cells don't always shed all the cancer genes in the bloodstream. So there is some false, what we call false negative results. In other words, your tumor cells have the gene mutation, but it is not present in the bloodstream. So the liquid biopsies can be falsely negative in about 15 to 20% of the instances. So now we use combination of both tumor testing as well as the blood-based testing to identify what genes are driving these tumors.